Stanford University.
Next, I'm going to introduce Janet Leader and Lisa Goldman Rosas, and I have to introduce Janet as one of the directors of Second Harvest Food Bank. And 2 years ago at the first Food Summit, Janet said, "You really made a mistake. You didn't invite the community. And so no good deed should go unpunished. And so the community is here, and now she has to present." Thank you very much, Janet.
Thanks, Christopher.
Are you going to do it?
Hi, everyone. How are you? I hope everyone's enjoying the conference so far. I'm so excited about all the presentations that we have going on. And I want to tell you a little bit about our partnership with Stanford doing research at the Second Harvest Food Bank. And so I'm going to tell you a little bit about what the food bank does, because most people think of the food bank as that little pantry in the church that you know about, or they're not quite sure what we do. So I'd like you to have a good picture of what we do so you understand what the research was about. The first slide says that we're an organic partnership, meaning that this partnership arose naturally from this meeting, and we're very excited about the work that we've been doing with Stanford. Here's a picture of one of our warehouses. A lot of people come into our warehouse and say, "Oh my gosh, it looks like Costco." Only in that it's so huge. And we have 3 warehouses in San Mateo and Santa Clara County. And you can see they're huge. There's all this food, and we give it away for free. So to hungry people in this area. These are the sites that we distribute the food at. It's all distributed for free. We're one of the very few food banks in the whole nation that doesn't charge our partner agencies to take the food. And we distribute the food for free to our client members. This is a picture of our warehouse on Kirtner Avenue. You can see all the produce in here. I'm going to say a little bit more about that in a minute. We just opened a new warehouse this past summer on First Avenue. It was donated by Cypress. They gave us the building. They knew we were looking for more area to put our fresh produce in. And over 55% of what we give out is fresh produce. And again, I'll say more about that. But we needed a spot to put that. We needed more refrigeration to put that. So we have a whole warehouse now donated to fresh produce. And here's a picture of our Cypress Center. And you see the inside with the oranges in our food sorting room. We have volunteers come in there and help us sort it into bags so that they can be distributed. You should come and volunteer. It's so much fun. So I want to say a little bit more about how we work. We have two ways of receiving donations, as food, as money. We can buy food a lot cheaper than people can from the grocery store because we buy it in huge amounts in bulk. We serve over 273,000 people every month. 1 in 10 people, we're serving 1 in 10 people in these 2 counties who are hungry. And that's not even meeting the meal gap. So there's 1 in 4 people we assume are going hungry in this area. So we're serving 1 in 10, and we need to serve more, but that's what we're able to do now. So what we do is, let's see, this great thing. Okay. So our 2 models are, first, we give food to our partner agencies. That could be pantries, soup kitchens, transitional housing, shelters, things like that. One of the students mentioned that they give food to Opportunity Center. We give food to them as well. The other thing that we do is we do what we call direct service sites. And that's where in our food bank truck, we drive up to a school, a church, or someplace. We unload the food there. People are waiting to get the food. It gets distributed with our incredible volunteers who unload the food. They have a whole system down. They unload it. People are able to take the food, and they take it home. We pack up, we drive away, and you'd never know we were there because now it's a school again. So those are our direct service sites. And I wanted to, tell you a little bit about those. We have brown bag, brown bag, where we sometimes deliver food right to people, or they come and they get about 20 pounds of food every week. We have Family Harvest, where families with children under 18 can come and get 130 pounds of food once a month, and that includes ground turkey, eggs, milk, cottage cheese, and like I said, over half of it is fresh produce. And this is a produce mobile where it's solely produce, and anybody can come to that. Anybody who is 200% of the federal poverty level or under. And all we distribute there is fresh produce. We also have something called a mobile pantry for areas where it's a food desert. So that could be on the coast, like Half Moon Bay or Pacifica, or in some areas in San Jose where there's just not access to healthy food. And so we will go there and bring out our truck and have a whole variety of foods for people. You don't even have to be a family. You can be a single adult for that. Okay, too many buttons to push. All right, so this just reemphasizes what I was saying about how we feed about 243,000 people on average every month. And that means 1 in 10 people in the Bay Area. So if you look around you and look at 10 people, one of those people represent how many people are hungry in the Bay Area. It's a hidden population, and we don't always realize it. But I wanted to tell you too that we have something called the hunger index that we've calculated, and that this is out there on that round marble table. I encourage you all to pick it up and see what the face of hunger is in this county and how much there is. I've had doctors here say to me, I didn't know there was hunger in this county. You don't see people with distended bellies. But that's not what it looks like in this county. What it looks like are people who were laid off managers and they can no longer feed their families. They had a job, but now they've lost their homes, their cars, etc. And they cannot make it without some support. So 55% of the food that we distribute is fresh produce. And we are so lucky here in California that we're able to do that. The California Association of Food Banks has a program called Farm to Table. And what they have done is contacted farmers who have these different size vegetables and produce that consumers don't necessarily want. We as Americans are so picky about the kind of produce that we want. We want our apples to be a certain size. We want our cabbages to be a certain size. So if the cabbages are too big or too little, the farmers plow them back under. Or they get donated to pigs, to feed the pigs. So we said, we'll take that produce. Our clients will take a larger cabbage or a smaller cabbage or misshapen potatoes that are perfectly fine. So the California Association of Food Banks has arranged for all food banks to have access in this state, to have access to that produce at a relatively inexpensive price of around 9 or 10 cents a pound. And that produce comes directly to the food bank from the farm. It doesn't go via anybody else, so it really saves on costs. And of course, we are really anxious to give out as much produce as we can because, as we all know, having fresh produce is eating that is one of the ways to help prevent diabetes, manage obesity, et cetera, et cetera. And what we give out, we particularly in this county give out more produce than any food bank in the United States. We're the largest because we're able to, with our new produce warehouse, we're able to manage it more. It's very tricky when you go from canned and dry foods to trying to manage that turnover of that fresh produce. You can imagine some slimy strawberries appeared quite a bit as you're trying to manage that. But now we're really able to be on top of it, get it out quickly so that our clients have that fresh produce. We also have nutritionists who are teaching in the field. Right now we have 5 nutritionists because we have a USDA SNAP Ed grant, and SNAP is the new acronym for food stamps, if you're not aware of that. So our nutritionists are able to go out there to people who are getting all this produce and say, I don't know how to cook this, this is unfamiliar to me. And we're able to give them recipes and to give them instruction and do food demos, as you see Monica doing there, showing them how to actually prepare that food. And people then take it away. Our site coordinators say, thank goodness you were here because now they took all that winter squash. This is a picture of some of the tip cards that we developed. They're in 4 languages, and we have made them low literacy. I have a whole talk about how to make these things low literacy and simple ingredients. We try to keep it to 5 ingredients. Like I said, they're in 4 languages. We tell people how to store them, how to prepare them, some quick serving ideas, and a simple recipe. We distribute about 20,000 of these recipes a month, and about 10,000 people say that they use them every month. We also know that we can't give enough food. What we give out is still not enough to help everybody all month long. So we are also doing CalFresh or food stamp outreach. We do the outreach, we help people fill out the application, and we submit it to the county for them. That enables us with our bilingual staff to kind of debunk some of those myths. There's a lot of myths out there about food stamps, and we're able to help them do that. So I just want to kind of wrap it up a little bit and say it's more than a meal. Here's a picture of someone. It's people who can't afford to feed themselves all month. If you want to help, you can volunteer. Here's a picture of Steve Young. You might recognize him. The 49ers work with us to volunteer. We have food drives. I see barrels around the Stanford campus. Thank you so much for doing that. Appreciate that. And we've also been working with PPOP, Lisa and Randy's group in SPRC doing research. And Lisa's going to talk about our client survey, our annual client survey, how they made it so much better for us, the focus groups, how are clients receiving and liking the food, and our nutrition measurement system. How are we ranking the food? How do we consider nutrition as we give that out to people? Thank you.
Thank you. What do I press? This one.
That one goes first. Can I just say one more thing?
Please.
There's also on the table are these need food cards. If you come in contact with people who need food, or if you just want to make a donation, please pick up some of those cards off that table and distribute them freely and with wild abandon, because a lot of people don't know about all the services that are available in the community, and we will hook them up. Thanks.
Thanks, Janet. So like Janet said, my name is Lisa Goldman Rosas. I work at the Stanford Prevention Research Center in the program on prevention outcomes and practices. Our head is Dr. Randy Stafford. And we came together with Janet and some of her colleagues at the last Food Summit and started to talk about ways that we might collaborate. So I think, as Janet said, this was very much an organic partnership that happened in a room back there in the afternoon discussions. And we really came together around this issue of food insecurity. So in our research group, we do a lot of community-based research aimed at decreasing chronic disease or preventing chronic disease among low-income populations, primarily here in the Bay Area. And while I think nationwide about 1 in 4, or 25%, I should say, report some level of food insecurity or inability to obtain healthy food in socially acceptable ways sometime in the past year. In the populations that we work with, that tends to be a lot higher. So in one of our projects in Fair Oaks, which is here in Redwood City nearby, a low-income Latino neighborhood, around 50%, if not a little bit more, report some level of food insecurity within the last year. So while we're trying to teach folks about how to eat healthy and how to obtain healthy food and prepare it, they face a real barrier. So it's not just about knowing what to eat, but it's knowing how to get that food. So we work quite a bit with Second Harvest on the local level. So one of the ways that we started implementing that, excuse me, after the last Food Summit, was some of our research staff said, hey, we should go and volunteer with the Family Harvest program in our local area of Fair Oaks and start to figure out how our participants get that food and how we could incorporate that into our lessons about how to eat healthier. So our staff went out to our local Family Harvest distribution site and started volunteering, seeing all of our participants from our NIH-funded research study coming in, picking up their food for the month, and we started to think, okay, how are they going to incorporate this exact food into the meals that we're teaching them how to prepare? So we would get the extra food that was left over, and some of our great staff would go back and start to prepare meals that we would then serve in our health education sessions. So we figured out how to incorporate all the cabbage and potatoes and onions into healthy, culturally appropriate, tasty meals that they could use. We then served it, shared our recipes, and our participants really learned quite a bit from that. So then we also contributed some of our research knowledge to try and help the folks at Second Harvest take a look at this amazing work that they're doing and try and evaluate it. I think until Janet actually takes you into their warehouse and you see the massive amounts of produce that they are giving out, you can't even really comprehend. I mean, I think, like Janet said, we're used to thinking about food banks in terms of cans of food and boxes of things, but this is a huge freezing warehouse where they have tons and tons of produce, huge trucks. It's just a massive enterprise. And so what Janet and her staff were really asking was, are people able to really incorporate this food into their daily diets? They are, the most cutting-edge food bank in the United States, and they are offering an amazing amount of produce. And are the people that they're serving, their clients, really making use of this? So that's what we set out to do to find out more about. So they conduct an annual client survey that we helped out with this year, with a lot of help from student interns, most of our Hum Bio interns that come and work with us. And we conducted 416 surveys at the various sites around Santa Clara and San Mateo counties. They were primarily Hispanic Latino, and then very diverse besides that, Vietnamese, white, Chinese, and other. And I think one of the things that we found that we were so happy about, we asked participants to tell us how many servings of fruits and vegetables they ate per day when they didn't have the food distribution from Second Harvest Food Bank. And then we asked them to tell us, well, when you do get the food distribution from Second Harvest, then how many fruits and vegetables do you eat per day? So what we found, how do I do this? There we go. Is the dark orange is when they didn't have the Second Harvest Food Bank distribution. And so you can see that primarily they're between 0 to 1 servings, 2 to 3 servings per day of fruits and vegetables. And then that significantly bumps up once they get their food distribution from Second Harvest. And the majority are saying that they do get 2 to 3 servings per day, or even 4 to 5 servings per day. So, what we're really shooting for is over here. We still have work to do, but I think what that shows is it's making a significant impact on the amounts of fruits and vegetables that people are eating every day. Another thing that we saw in the data, and that we also heard quite a bit from in the focus groups, was that people are really eating at home more. And the hope is that eating at home more translates into healthier food. But the majority of people said, thanks to the food I get from Second Harvest, I eat at home more frequently. So then we went out and conducted 5 focus groups in English, Vietnamese, and Spanish, and talked to folks in the Family Harvest programs, the Brown Bag programs, how Second Harvest was really impacting their diet on a day-to-day basis. And people told us a range of opinions, from both positive to constructive feedback about how things might be improved. We heard some themes over and over again. So one woman said to us, I didn't know how to eat squash, but now I make it with a little bit of brown sugar on top, thanks to the recipe card. So she had no idea what to do with an acorn squash before she came to Second Harvest, and now she knows how to eat them. And then another person, and we heard this quite a bit, is we want more meat. Meat is really expensive and hard to get, so we did hear from the participants that they wanted more meat. Another common theme, similar to the squash, is I learned to eat foods that I never would have eaten before had I not come to the food distribution. So what Second Harvest does a great job of doing is making foods available for a wide range of cultures and ethnicities. And so people really learn to eat different foods that they might not have had the chance to learn about had they not come to Second Harvest. So that was really exciting to see. And for some people, that was also a challenge. So people who weren't of Hispanic background would say, I have no idea how to eat beans and tortillas, so sometimes I get them and I don't know what to do with them. People talked about how they responded to the availability of foods, which obviously changes according to the seasons. And so some folks said, whatever I get, I just build my meals around that. And obviously in the winter, if you've ever been part of a CSA, you know you tend to get a lot of the same thing. So that happens to Second Harvest clients as well. Get too many potatoes and onions sometimes, not sure what to do with them. So our future directions is to really focus on this food measurement system that Janet mentioned. She's really interested in figuring out a way that we can kind of quantify the nutrition content of the foods that they're distributing so that they can monitor and measure over time how they're doing. Right now they have a really simple system they use of grading food on a system of 1, 2, 3. And what we're trying to do is come up with a more sophisticated way that we can monitor and measure the types of food and the quality of food that they're distributing. So that's really our next challenge. It has to be well integrated into their massive food distribution system. It has to be something that people can implement quickly as the food is coming in and being sent out. It has to be appealing to consumers so that they know how to interpret it and use that information. So I'm hoping that with all these bright minds in the room, if anybody has any ideas and wants to brainstorm with us, this is really our next challenge. So come talk to us, give us ideas. If you are an engineer or know lots about food distribution or are a nutritionist and have ideas of how we could measure it, we'd love to hear from you. So to conclude, I think Janet and I would just like to thank you for listening to kind of our story of how we came together to work at the food bank, how we've taken advantage of resources at Stanford, and kind of our immediate future in terms of our food measurement system. So come talk to us. We'd love to hear more. We'd love to collaborate with you. And thank you very much.
For more, please visit us at stanford.edu.